I'm Alex Garrison, and this is Speech 2. I'm not an expert on HIV infection, nor do I personally know anyone who may carry the infection. However, I am a very sympathetic person and express that sympathy towards anyone who does carry HIV, especially if it involves an infant. An article that caught my interest was, quote, U.S. babies cured from HIV raises hope. New questions, end quote. The article basically explains how a Mississippi toddler born in July 2010 was infected with HIV and treated within 30 days of delivery with aggressive HIV therapy. The triple drug therapy continued for 18 months, and the child is now considered cured of her infection. By reading this article, I have developed a deeper understanding of how deadly an HIV infection really is. When I have completed my presentation, I believe you will be surprised by some of the facts involving the infection itself, and more specifically, the potential curing of it in young children. First, what is HIV? Mayo Clinic describes HIV as a sexually transmitted infection that can be spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. It has been stated that it takes many years for HIV to weaken the immune system to the point that you have AIDS. Unfortunately, the infection ultimately continues to decimate populations in Africa, Haiti, and even parts of Asia. Worldwide, as many as about 1,000 babies are born infected each day. However, scientists believe it will take a lot more research and many more sensitive diagnostics before the idea of eradicating infection in infants worldwide becomes a reality. Clinically, it seems as if you can put an infected baby onto antiretroviral drugs immediately after delivery. It will be possible to reverse or even prevent the infection. Even so, it was made aware that the child's case is an important proof of concept and that it was only one case that needs to be further validated. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, claims the real question is, will this be broadly applicable to other infants? And there's a risk that without better diagnostics, children who weren't even infected in the first place could be exposed to toxic drugs with very early treatment. In the case concerning the Mississippi girl, a pediatric HIV specialist made the call to treat the infant with HIV drugs before the infection was confirmed, simply because she was at such a great risk for infection. Furthermore, had her prediction been wrong, the therapy would have come to a halt. It was believed that the approach of treating early needed to be pursued, and that when better diagnostics are attained that show whether a baby is infected within the first day or two, the approach may be a reasonable thing to pursue the appropriate clinical trials. I hope my presentation has given you a closer look at how potential cure for such a widespread disease may be in the grasp of everyday medicine, and that although it may not seem set in stone quite yet, there is a hope just around the corner.